Now we will demonstrate how to do a repair of the radial tears of the posterior arm of the lateral meniscus or the medial meniscus. So this is the radial tear of the posterior arm of the lateral meniscus. So we will be using a knee scorpion device on which a 2-0 fiber wire is mounted like this. Now we will take the 2-0 fiber wire, go up to the tear, open the mouth, and onto the lateral aspect of the tear we will grasp the meniscus and we will fire the knee scorpion. You will see that the one thread is coming out. Now we have to pass this through the another side of the tear. We will unload this, and the other end now we will use this other end, we will mount it onto the scorpion. We will go below the meniscus onto the lateral edge. We will fire the scorpion and we will see that we created our first knot, first suture for the, so this way we can put the alternate half inches to do the repair of the radial tear. So this is the one way. The only disadvantage is that the knot would be on the top of the superior surface of the meniscus. So to shift this knot onto the under surface of the meniscus, we may use a relay technique, which we will demonstrate right now. So again we have created the radial tear. We will use the scorpion with 2-0 fiber wire. We'll mount it and you will see that this has come out. So now what we will do, we will take one more 2-0 and we will mount the scorpion under the center of the full length of the fiber wire, so as to create a loop. We will go on to the other side of the meniscus, the other side of the tear, and with this we are able to form the loop. And once we look at this loop, in this loop we will feed this suture which was taken as the first bite of the meniscus. And once we relay this, you will see that our knot will go onto the under surface rather than on the superior surface. So we will start tying it. So we will use a knot pusher. You can see that rather than going on to the superior surface, this knot is going on to the under surface of the meniscus. So you can see the difference between the two techniques. In the first technique, the radial tear was repaired using the scorpion, but the knot was onto the top surface. But in this technique, the knot is on the under surface of the meniscus. Thank you.